A healthy optic nerve head is of pink color and has, as you can see here, a small light-colored central cup. The pink color hints to the fact that there are nerve fibers with a good blood supply. In glaucoma, the optic nerve head is pale and shows a typical excavation. At this site, the tissue is only poorly supplied with blood. The primary cause of the loss of optic nerve fibers is a disturbance in circulation. The intraocular pressure plays a role in this disturbance because its rise may be the reason for an increase in intraocular venous pressure, which in turn decreases the pressure gradient called perfusion pressure. This mechanism is comparable to a hydroelectric power plant. If the turbine house is elevated, the efficiency is decreased. Here we see the distribution of IOP in 50 glaucoma patients. It is generally assumed that the retinal venous pressure is of the same amount. However, we didn't follow this assumption in these 50 patients and measured the retinal venous pressure. It is evident that retinal venous pressure values were substantially higher than intraocular pressure. These high values were seen in patients in which the central retina vein did not pulsate. This condition could be easily observed by ophthalmoscopy. This third of our 50 patients had a high retinal venous pressure and, as shown here, a low intraocular pressure. In patients without a spontaneous pulsation of the central retinal vein, we have to measure the retinal venous pressure. For this purpose, we use the contact lens dynamometer. With this method, the central retinal vein is observed and simultaneously the force to the eye is increased until a pulsation of this vessel is recognized. This attachment force is calculated from the signals of the built-in strain graphs. Based on a biophysical regression, the force is converted to a corresponding value of enhancement of intraocular pressure and displayed on this liquid crystal display. Some training is necessary to assess reliable measurement values. Additionally, the instrument has to be handled with great care. These limitations are the main reasons why contact lens dynamometry is not widely used by ophthalmologists yet. Therefore, an instrument was developed in order to make this new parameter more easily accessible for ophthalmologists. The principle is simple. If there is no spontaneous pulsation of the central retinal vein, force to the eye is exerted by inflation of a small balloon. This induces an increase of intraocular pressure, which may stimulate a pulsation of the central retinal vein. The threshold pressure at which a pulsation is observed is the retinal venous pressure. This procedure is similar to the blood pressure measurement according to Riva-Rocchi. The small balloon, more exactly the Pillunat, is mounted close to the eye by means of a frame. This balloon is connected by a flexible tube to a motor or pump, which is operated by a paddle. An examination by the IOP Stim makes sense in case there is no spontaneous pulsation of the central retinal vein or one of its branches on or near the optic disc. These conditions given, it may be assumed that the retinal venous pressure is higher than the intraocular pressure. The amount by which it is higher can be measured by the new IOP Stim. At first, the pupil is dilated for the ease of ophthalmoscopy by the Helmholtz instrument or by a 90 diopter lens at the biomicroscope. Prior to the attachment of the balloon, surface anesthesia is obtained by an eye solution. After fixation of the frame to the head, the system is activated and it fills the balloon with air. By contact with the eye, the balloon is retracted. Now, the white base of the balloon can be positioned close to the eye, and a negative pressure value is displayed. Then the examiner is inspecting the central retinal vein and/or their branches on or near the optic disc. By a pedal he activates the motor pump and the balloon increases its size. As soon as the central retinal vein or one of their branches pulsates, the motor pump is stopped and the filling pressure of the balloon is maintained. Under this condition, the intraocular pressure is maintained also for at least 1 minute. It is the threshold pressure and may be seen as the retinal venous pressure. It can be measured now by a commercially available tonometer. After the measurement, the air in the balloon is deflated and the frame is removed. Different tonometers may be used also for the pressure measurement. Indirect ophthalmoscopy at the slit lamp with a high diopter lens is also possible. In summary, the IOP Stim enables the ophthalmologist to measure the retinal venous pressure by methods familiar to him since his first days of residency.